So one of the big challenge that we have, and we encounter that if you parallel that with COVID, we realize that the infection and the disease expression is highly variable, and there's many factors that contribute to that. If clinical disease would equal detection of a pathogen, and there would be nothing beyond that, it would be relatively easy from a clinical and diagnostic standpoint. Unfortunately, we know that all these viruses can also be present and circulating among healthy horses. And that's really what I want to talk about, is that kind of like that comparison between the clinically affected animal versus the healthy performance horse that goes to a show that potentially is infected but is not displaying clinical signs. So if you wonder what these infections are and how they look, I'll just give you a little bit of a background. Respiratory viruses are highly common, and if you look at them, they represent one of the most common entities that equine veterinarian would encounter. So amongst all infectious pathogens, the one that affect the respiratory apparatus is probably the biggest one. And there's a variety of pathogens that are listed there. You don't need to know the names, but specifically this is influenza virus. We have 2 herpes viruses, 1 and 4, and we also have rhinitis viruses, equine rhinitis A and equine rhinitis B virus. So these are the main and common respiratory pathogen that we deal with. There are also bacterial organisms, one of them for which you guys already have a test, Strep equi subspecies equi. It's the pathogen that causes strangles. These pathogens, as I said, are highly prevalent in horse population and generally affect young stock. The morbidity, which is clinical expression, will be relatively high in a susceptible population with a output or a negative input that is generally low. So the consequence of infections are generally low. One aspect that I feel is very interesting with this pathogen is, as I mentioned earlier on, disease expression. And we all experience that with COVID. If you look at older people, more likely to develop severe clinical disease. If you look at young people, unlikely to develop even clinical disease. And the same happens with horses. Unfortunately, there's many host-dependent factors that we're still trying to understand for this pathogen. If we look at what we get through the lab, and I try to compile here data set from close to 10,000 submission over a 9-year period. So these are nasal swabs submitted to the UC Davis PCR lab from horses with acute onset of fever and respiratory signs. And we see that 1 out of 3 horses ends with a hit. 1 out of 3 nasal swab. In 1 out of 3 nasal swab, we can actually detect a specific respiratory pathogen. If you look at the frequency of detection, we see that viruses are the most common one, with equine herpes virus 4 and equine influenza virus leading here the order of respiratory pathogen, and we have Strep equi and to a lesser extent equine rhinitis viruses, and last but definitely not least EHV1. If you consider the relatively low detection rate of EHV1, and then you ask yourself, why is it that we have so much fuss around it? It's because EHV1 can, beyond the respiratory disease, cause some more severe clinical entity, mainly abortion as well as neurological disease. The graph here shows a compilation of the pathogen by month, and what you can actually see is a seasonality to the detection of these pathogens. So respiratory pathogens are more commonly seen during the colder month of the year, very similar to what we experience in the human field. This right now is winter. With winter, we have changes in ambient, we have lower temperature, high humidity, we have greater density of people, but the same happens also with horses, greater density of horses, more young stock, which really promotes the spread of these pathogens. So if you ask how to diagnose, I'm glad you asked how to diagnose. Am I right, Eric? You always wanted to know how we diagnose these conditions. I would say the majority of equine veterinarians will probably look at a respiratory infection, put together historical data and clinical presentation. If you have a herd out of which a large number of horses display respiratory signs and is elevated rectal temperature, you can consider that likely there is a viral respiratory infection going on. And the reality is most veterinarians will stop there. and then we'll take the precaution and then move on. Maybe they'll run, blood work, a little bit of blood work. And I think that's where Floxagy is really going to make a huge difference. If you consider is from the time you realize that there may be an outbreak to the time you can detect it, there may be a span of 24 to 72 hours. Why that is because the biological sample need to be taken, they need to be shipped, they need to be processed in the laboratory, and then the result need to be reported. So that takes time. By the time that result comes back, that veterinarian better has taken the right precaution, otherwise there may be a potential spread for this pathogen. So if you look at trying to define the etiology, the best way to do that is actually through PCR. And there's no doubt that PCR has supplanted all other assays. The lateral flow immunoassay, the rapid test have definitely not been very sensitive, at least in the equine field. Culture is one way to conserve these pathogens and characterize these pathogens, but it's a way that is too cumbersome, too time consuming when it comes to a diagnostic approach. So PCR in a parallel setting is definitely the way to go. And then down the road, there's always the options to do serology. That's more from a retrospective historical standpoint. So let's look at a real scenario. As I said initially, I really want to make that difference between clinical disease and detection and pathogen, as well as detection of pathogen in the population of healthy horses. So I'll see if the video plays here. So typical example here, you got a herd of young stock. In this instance, this is a little colt, and the majority of these horses are displaying the same similar sign as this one. Elevated rectal temperature, bilateral nasal discharge, and that cough, that repeated cough. So if you have veterinarians and you put the two together, you have clinical entity, you have multiple horses affected. The idea right now is to try to detect the culprit. Conventionally we use Ryan tip nasal swabs, the short 6-inch swab, and we generally submit them to laboratory that tests for a variety of pathogens. We like the parallel testing, which is a testing of a variety of respiratory pathogens that are associated with a very specific syndrome. But as I said earlier on, this may take time. This is where Floxagy is definitely going to be a game changer, because you'll be able to do, or you're actually able to do already, the detection of some of these pathogens in real time. For this specific horse here, we got PCR result back. This horse tested positive for EHV4 as well as equine influenza virus, and was negative for the other respiratory pathogen. So the question is, well, which of these two pathogens is driving the boat? Honestly, it doesn't really matter. One will be plenty to act on it. Now we have an EHV4, generally causes upper airway disease, no cough, and we have an influenza virus that is known to affect the lower airway. So probably equine influenza virus is the one that is driving the clinical entity. So once that information is available, even before that information is available based on the history and the clinical disease, one would like to engage in procedure with the goal to reduce the spread of respiratory viruses. Why that is because every horse that becomes affected will potentially have loss of use for a certain time. Outbreaks are never good for any barn or any showgrounds. Therefore, it is essential to trying to prevent the spread. It's not any different if we're looking at the strategy to what we're doing these days with the prevention of spread of SARS coronavirus 2. So the first step is bioconfinement. Any horse that is sick, that's you staying home when you have fever and snotty nose. Not any different when it comes to horses. We also need to monitor the horses that are close by. It's not because you have identified the sick horses and you have removed them from that environment that additional horses may come up with clinical disease. So that monitoring is generally prescribed and encompasses the twice daily monitoring of clinical signs, mostly respiratory signs, as well as elevated rectal temperature. And then there's a whole set of biosecurity protocol. And the idea of the biosecurity protocol, again, these are measures aimed at reducing the spread of any respiratory pathogen. So we put the emphasis into cleanliness, into barrier nursing, which is, the gloves, the booties, the gowns, minimizing traffic, but also having personnel that is really dedicated on one side to the sick animal, care of the sick animal, and on the other side to the care of the non-sick herd mates. So again, that's the scenario of a sick animal. Relatively straightforward. Animal sick, animal gets tested. If test positive, what we do? Well, I just listed here a variety of steps with a goal to prevent spread. Now, we also have to consider that beyond clinical disease, there are horses out there that are shedding respiratory viruses. And we know that that's true for most respiratory viruses in almost every mammalian species. And what drives that rate of what I call subclinical or asymptomatic shedders? There's very factors there, and these factors are poorly understood. They're just observation. Season plays a role, age, and use. The typical example would be the toddler going to daycare. That's a high-risk population, believe me. For those of you who have toddler and kids, you have experienced that. Kids goes to daycare, is very happy, comes home, has a snotty nose, the next thing you know, you have the snotty nose. The same is true for horses. We know that wintertime, which is the time where most of the shows happen, so winter, springtime, looking at the colder time of the year, is the season where we see greater frequency of these viruses being transmitted in clinically diseased animal, but also in subclinical shedder. We also know that age and use. We're looking at the young performance horse. So these would be, 3 to 10-year-old horses that are going to these large shows. Interestingly, last year, 2022, was a very busy year when it came to infection with respiratory pathogen, mostly EHV1. You guys have heard about it. Some of you have been involved and have had the chance to sample some of the burns and help with the sampling some of the horses. So just to recap a little bit, 2022 was bad. In the spring of 2022, there was a first case of EHV1 infection that led to neurological disease in Riverside County at a very large showgrounds. That's the Desert International Horse Park. What happened from there is some of these horses that did not display clinical disease then went back home, and that led then to the spread and additional outbreak. There were a total of 16 outbreaks at 16 different facilities that was linked to that initial outbreak in Riverside. Just to make a long story short, we had many opportunities to gather sample, and one opportunity came from a regulatory decision that was taken from UCSF, so United States Equestrian Federation, as well as CDFA, our state regulatory agency, that mandated a quarantine of 28 days for each horse that attended the Riverside event. Not only had these horses to be quarantined at home, but they also had to be tested at least once for EHV1 in order to be allowed to compete in the next event. And the next event was in mid-April of 2022. So the lab at UC Davis got a lot of sample, a total of close to 640 nasal swab with the purpose to test them for EHV1. And this graph here shows the respiratory pathogen. You can look at EHV1 here on the first row here, and you can see by week, meaning the weeks are the weeks after they instituted that cancellation of the event. So you see 5 weeks, which is 35 days. And what you can see is, first of all, an increase in the frequency of detection of EHV1, and then a decline. And it's not uncommon because we're still at the end tail of an outbreak. So there's still dynamic and transmission occurring amongst these horses. But the interesting part to me was looking at other respiratory pathogen. And we found other respiratory pathogen. We found some strep equi, which is a bacterial organism. We found equine herpes virus 4, equine rhinitis B virus, as well as equine influenza virus. So interestingly, these other respiratory pathogen generally don't cause, or they can cause outbreak, but generally are not associated with outbreak at large show. But just gives you an idea that that rate of subclinical shedders in that specific population at that time of the year was somewhere in the single digit, from 1 up to 4%. So we followed up this with the first show that was reopened. It was a 5-day show in Blenheim, California, and Eric probably remembers it well because Fluxogy's team went up there and collected some swabs. So the idea was that these are show horses that have been confined at home for 30 days and tested negative for EHV1. So that's a supreme clean population. That process of stopping and canceling the event for an entire month and having the testing of these horses really stop that EHV1 outbreak. So the idea was, if we sample a large number of horses and we also sample the stall at the end of the event, we would have a good reflection of what these horses are actually shedding during the spring of 2022. So we ended collecting nasal swab from approximately half of these horses. This was, again, a 5-day event. The swabs were collected on the 3rd day, nasal swab. They were collected by a veterinarian that was on site. We also decided to focus on the environment. I'll get back on the environment in a sec. So we decided to swab all the stall, individual stall of these 162 healthy horses at the end of the 5 days. So these horses were stabled in the same stall, and then they went to the different classes and then came back. Why did we focus on stall versus nasal swab? The way I look at it is the nasal swab and the detection of pathogen in the nasal swab gives you a real-time assessment for the shedding of any pathogen for that horse on that day, at that time. You don't know what happened a day before. You don't know what's going to happen 24 hours after you collected the swab. If we swab the environment on the other side, we have a history of the 5 days of stabling of that horse. In other words, if a horse is shedding during the 5 days, these pathogens will accumulate in the environment. Although they may not be viable and represent a risk to other horses, they are still detectable. So just to set the platform. So what did we find in that population? So 3 horses tested positive for respiratory pathogen. We had 2 horses with equine rhinitis B virus and a horse with strep equi. And if we look at the different barns, the 2 that tested positive for equine rhinitis B virus, they were stable in different barns. So there was no connection between the 2 horses, at least based on the stabling process. If we look at the environment and environmental swabs and the result, and that was kind of surprising, we had 2 stalls that tested positive for EHV4, and we had a cluster of stall positive for EHV1. Very surprisingly. And interestingly, this was the first show at that showground of the season, so there is no residual pathogen there from the 2021 show. The interesting part is, if we plot these positive horses and also the positive stall in this lower graph here, this lower graph represents that barn C. You can see in red here is the cluster of positive stalls. Then we have a positive EHV4 as well as 2 positive horses in nasal secretion. And what we discovered with this is the power of environmental monitoring. You can monitor the horse, but as I said, the result will only tell you the status of that horse for that sample you collected on that time point, while the stall gives you more like a historical background of what the horse has been shedding for the past 2, 3, 4, or 5 days. The interesting part is the disconnect between what we find in nasal secretion and the stall. The more concerning part is to see that subclinical shedding still happens in these horses, and that led to the contamination of these stalls. Now, to go back to, and this is a pure hypothesis, how do these outbreak of equine herpes virus 1 myeloencephalopathy occur in this high-risk population? You know, we've seen that at Thermo last year, we've seen that in Valencia, Spain 2 years ago, we've seen that in Ogden, that was 2011. One hypothesis is that healthy horses go to shows. I mean, assuming that only healthy horses go to show, these healthy horses go to show, some of them are subclinical shedders. So they're shedding EHV1 as well as other respiratory pathogen without ever developing clinical signs. So what happens if you put these horses in the same stall, in the same barn, and leave them there for several weeks? Well, if they're shedding, that EHV1 contaminates the environment, but potentially can spread from stall to stall, from horse to horse, and even go outside that barn, and then eventually hit a population of more susceptible horses, and that may potentially be the beginning of an outbreak. It's a pure hypothesis, but instead of focusing on the sick horse that may be the trigger for an outbreak, we should be looking at the environmental contamination and the pattern of transmission at an environmental level as a potential risk factor to trigger an outbreak. So here's the last one of the studies that we performed, different population, different time of the year, just to show you how the information that we gain from this study is highly variable on the population that we test, but also the season. So we ended performing an additional study in the Midwest at a very large event. It's a 15-week event that happened in the Michigan area, a large population of horses. We randomly selected 6 out of 12 barns, had consent from the trainers to then in each of these barns collect 20 nasal swab from specific horses, as well as collect the environment on a weekly basis. So we ended with quite a large number of environmental swabs as well as a large number of nasal swab. If we look at the result here, we found amongst the horses in nasal secretion, we predominantly found equine rhinitis B virus. We found one case of EHV4 and a case of strep equi. So that's a distribution of pathogen in nasal secretion that I would expect. These aren't very pathogenic pathogens, so that's probably the reason why none of these horses had clinical disease. If we look at the stalls, we had close to 2% of the stalls that tested positive for equine rhinitis B virus only. So no EHV1 in these stalls, no HV1 in these horses. And it's an interesting observation. It goes back to the season has a lot to do with the promotion of the spread of EHV1. So again, how do we prevent the subclinical spread of any respiratory pathogen? That's a little bit more complex to do. It's same as we're dealing with COVID. It's easy to justify for somebody that is sick to stay home for 10 days. It's hard to justify all the measures that we take to prevent the spread of SARS coronavirus 2, which is, your health monitoring, the temperature taken at work, the regular testing. That's harder to justify, especially if you look at these large events, that these are multi-week events that will host somewhere between 700 up to 1,500 horses. it's hard to justify and then to change all these protocol based on an assumption that potentially an outbreak can occur. However, based on previous outbreak and the EHM outbreak, and these are highly devastating outbreaks for the industry, we know that we cannot prevent the spread of these pathogens, but we can reduce the spread and hopefully impact the outcome. And always say outbreak cannot be stopped. So we will not be able to prevent outbreak. That's just an occupational hazard. If we bring 500 horses in the middle of the winter on a small footprint and you have absolutely no biosecurity protocol and a lot of traffic, it's just a matter when it's going to happen again. But here's some of the protocols that have been successful, at least this year, in thermals, trying to reduce the risk of spread through these subclinical shitter. First of all, it's minimizing traffic and contact. We're all familiar with that. That's a good old game of COVID. You're 6 feet apart, and if somebody is coughing next to you, then go and sit somewhere else in the room, or even better, go sit in a different room. It's also important that we look where we stable these horses. Most of these shows bring in a lot of horses, and most of these horses, not all these horses, but a large group of horses come from the same trainer, from the same barn of origin. So these are horses that know each other. Even if pathogen are transmitted amongst these horses know how to deal with it. So it's important that we're trying to keep this population of horses kind of separate. And then there is a lot of steps that can be implemented at different levels with the idea to prevent interaction between subclinical shitter and susceptible horses. The daily monitoring is essential. Daily monitoring goes back to, is a horse sick? If a horse is sick and recognizes sick, suddenly has nasal discharge, suddenly has an elevated rectal temperature, that's a red flag. That horse needs to be taken outside of that stall, outside of that barn, and being isolated for further testing. Increase hygiene and cleanliness. We know that these pathogens can be transmitted directly from horse to horse, but we also know that any fomite, any instrument, any person that has it on hands, and believe me, there's a lot of interaction between people and different horses. If you think about it, there's cleaners, there's feeders, grooms, people that braid horses' mane and tail, there's veterinarians, there's farriers. So a lot of cross traffic between these different barns. And then one last step, if you think about it, in a perfect world, how could we prevent these outbreaks from happening? Well, we would be testing every single horse every day. Am I right? That would be good for Fluxology. Yes. Eric is like, let's do it. Yes. It's 1,200 horses every day. Nobody's ever going to do that. No owner is going to allow you to do that. But here's a different strategy. If you have daily monitoring, so you hope to red flag the horses in early stage of clinical disease, which is essential, but then you monitor the environment. As I showed with these previous studies, we can actually monitor the environment. We are to the point where we can actually, with a single swab, so with a single analysis, monitor and pool 5 to 10 stalls together. If we do that on a regular basis, we can look at pattern. And whenever we start seeing a pattern where there's an increased detection of a specific pathogen, that would be a red flag. We potentially have to go back, increase cleanliness, maybe institute better biosecurity protocol. And I feel that's where Fluxology potentially has a way to help out, is not just in the detection of pathogen in nasal secretion, but also the detection in the environment for these specific high-risk horses. So I promised I would end at some point. That's the problem. If you let me talk too long, I'll probably take the whole day. I hope I've been able to show that there are still a lot of discrepancy here between clinically affected animal and interpreting the result. The two generally are relatively simple to do as long as the appropriate diagnostic steps are taken or being performed. This is where Fluxology with a multimodal platform, cytometry, acute phase protein, pathogen detection is going to be a game changer in saving time and instituting the right biosecurity protocol. When it comes to subclinical shedding, that's a different platform, because anything that we do, we meaning that either regulatory or equestrian federation or event organizer, is going to be cumbersome, is going to be time consuming, and it's going to be costly. So are outbreaks. And if you look at outbreaks, an outbreak and the cancellation of an event can cost $100,000 to $1 million. A little bit of prevention could go a long ways. So the industry right now has really embraced the idea of monitoring horses. There's no fever policy, meaning every horse at a show event has to be monitored twice daily, and every horse with elevated rectal temperature is red flagged, and further diagnostic are performed these horses. Biosecurity, we are at the age where we understand biosecurity. We all apply biosecurity on a daily basis. It's easier to translate that. Still a lot of owner need to be reminded. And then last but not least, that environmental rather than the individual horse monitoring can be one approach in the future, trying to gain a little bit of momentum and better monitor this high-risk population during this multi-week event. Any questions pertaining to this topic?
So before those horse show, do they require all the horses to get a test, like basically prove that negative for all the rest?
So I may repeat the question. I don't know if everybody understood it. The question is there a recommendation to test every single horse prior going to show? The reality is that is not practical. It's not practical, and it's not sensitive enough, because as I said, how far from the event would you test a horse? First of all, is the capability to test all these horses, and what does a negative result mean? So in other words, you may test a horse 48 hours prior going to the show, and the horse tests negative. But on the day the horse arrives at the show, the horse has been stressed, maybe in contact with another horse, and the horse tests positive. You would know because you wouldn't retest. And it wouldn't be practical to test a horse on arrival. I mean, that would be the way to do it on site, point of care, that would be perfect. The reality is there's hundreds of horses that come in on the first day, and the second and the third day. So it would be very unpractical. So the short answer is no. There is no requirement. These are all recommendations. Now, if an owner wants to do it for safety purposes, they can do it. The other fact is, how would you handle if you test, let's say, 40 horses out of the same barn are all going to the same show, and one tests positive? What are you doing with the other 39? Do you let them go to the show? You would, yeah, but from a regulatory standpoint, you would know, because now you know the virus is circulating. Mm-hmm. So in a perfect world, we would do that. We would test, if we had maybe a rapid test that owners can do, by the time you get the horse at the showground, unload him, put him in the stall, do a test, it's negative, great, it's positive, probably isolate the horse, test later. That's practical. That would be practical. I'm not sure clients would pay for all the testing, because somebody has to pay. This is not, this is not supported by industry. This is not supported by state. So it has to be paid by the client. It would be perfect, but again, that single time point does not guarantee that viruses will not be spread. And we need, the best we can do is, a friend of mine had this very simple approach. How do you prevent outbreak? Well, it's two-step. Only healthy horses go to shows. Am I right? Which, remember, this is industry driven. So what drives the industry? Money. So if you have a horse that, you paid your entrance fee, still looks good, maybe he has a little bit of an elevated rectal temperature, give him a good dose of anti-inflammatory and still go to the show. That's human nature. The second aspect is every single sick horse gets at the show, gets red flagged, gets removed from that barn, and gets monitored outside the barn to be sure that nothing gets spread around. And that goes back to, are people honest? Are people meaning that, people that care for these horses, trainer, riders, grooms, and so on, are they monitoring these horses? And if they're monitoring these horses, would they report a horse with elevated rectal temperature? Because now that horse is disqualified to compete. We'll agree on that. So there's a lot of conflicting motions when it comes to, from a purely logical standpoint, it's doable. From a practical approach, there's a lot of hoops that we need to overcome. And a lot of that goes back to education. If people understand that we are all in to make and create a safer environment, it's better. But right now, people meaning horse owner, are more likely to bypass some of these steps, unfortunately.
Yeah, that's interesting that you bring that up. I feel like it's the idealistic thought process where they do want to test their horses, but it's like what the penalty that comes after it, right? They also want to compete. One of the ideas that you had previously was maybe having an assay where you don't differentiate which pathogen is there. You're saying just one of these pathogens is present. I wonder if that could be an interesting solution, because it won't. We don't want to bypass the regulatory process, but you're just saying something's there. This needs to go to this side. Maybe that could make testing more horses feasible, because you don't have a definitive.
But the owner would challenge, like, what does my horse have? Prove to
me. The difficulty, testing a sick horse is a no-brainer. You cannot escape that, am I right? That's just normal diagnostic workup. You got to know whether the horse is feeble. That's for the good of the horse. It's harder to justify and penalize based on result out of a healthy horse.
Yeah.
There's a lot, that's the part. No study has looked at the impact of a subclinical shedder. Maybe it's not coming from the subclinical shedder. These outbreaks that we're experiencing are not coming from subclinical shedder. Maybe I'm absolutely wrong. There is not enough information, scientific information, that tells us what's in the making of these outbreaks. Why is it that this outbreak happened? What is the origin of the outbreak? Here's generally the timeline of these outbreaks. Most of the outbreaks that happened in the past were all linked to EHV1 and neurological form. Why that is because that's a form of disease that has a tremendous impact. So the mortality, so the fatality rate is very high. So that's a disease that really captures the equine industry and definitely the media. So it has a tremendous impact. If you look at the clinical disease, horses don't just suddenly become neurologic. Horses become infected with the HV1, develop maybe a mild respiratory disease, a little bit of nasal discharge, maybe an elevated rectal temperature. And then a few days later, towards the tail end of that EHV1 infection, they develop the neurological form, equine herpes virus 1 myelencephalopathy. So if at a showground, you monitor for the horse that goes down, if that's your marker to raise that red flag, by the time that happens, you already have had 10 days, at least 10 days of that horse being in a stall, shedding a lot of virus, and nothing has been taken care of, so no prevention. So what we hope with the monitoring, which is the physical monitoring, is to capture the horses that will develop clinical disease in the early stage. The sooner they are removed from the general population, the less likely we will see future cases. The strategy are difficult to implement because no matter what we implement, there is no good scientific information to back these procedures. And that's a difficulty. It's hard to justify. The concept is great. Test every single horse on arrival, monitor every single horse, tell us if your horse gets sick. But then owner can challenge that and say, how do you know that this is actually a risk factor? Nobody has proven that. And it's difficult because these outbreaks, although detrimental, are sporadic and they involve a large population of horses. So it'd be nice if we could sample all the horses at Thermo. That's probably 1,500 horses right now. If we could sample them once a week, all of these horses, that would be great. Then we would know. We cannot do that. No owners or trainer would allow you to do that. But what we can do is to sample the environment, and we can monitor. So imagine we sample, and Eric and Fluxigy's team help collect the environmental sample. Thermo has 2,500 stall, individual stall. If we pool the stalls and put like 10 stall, one swab, that's 250 swabs. And it probably would take, how long you think it would take to do all of them? Just all of them. You don't have to do them all, but you decide to do all of them on one day. How many hours? 6 hours?
Yeah, maybe you'll have to ask Dale, Nicole, and Taylor, but probably somewhere in the 8 hours.
8 hours. 8 hours, 3 to 4 people.
That's
okay?
Long, that's long hours.
If you have 100 devices, it takes 2.5 hours.
So it's doable, and we don't have to do it once a week. We don't even have to do every stall. You can say we're just spot testing. We know that we can pool. The idea is to looking at pattern. Is there evidence of accumulation of a specific pathogen? So in other words, are we starting to see from 1 week to the next a larger number of stalls that test positive for a specific pathogen, which is it's great evidence that the pathogen is spreading. That would be feasible. Nobody would object to having a swab taken from a stall. Nobody would object to that. It's just a different approach. I'm not quite sure it's still feasible because, again, 250 swab doesn't sound like a lot, but somebody has to process them, all right? And somebody has still to pay for them. But 250 swabs is better than 2,500 swabs if you would swab every single horse.
Yeah. With Respiratory workflow, you don't have to do extraction, so that saves time too.
Mm-hmm.
Yeah.
And if you just spot test, so you could say, let's not do the stall. Let's just do areas that are high risk. So areas where there's a congregation of horses. Certain areas at the showground, some of the tent, the wash racks. So if you can figure out where is the best place with the greatest traffic, where I'm likely to find pathogen that are shed from subclinically infected animal and contaminate the environment, you may be restricting it to maybe 10 swabs a week, just to monitor that environment as a surrogate, as an alternative way than monitoring horses.
Lori has a question here. This is, I guess, more of an internal question. Are we going to support an off-label protocol for stall swab sampling for respiratory viruses? I think it's a great idea. Now the data is being collected more and you guys have done the testing on the big lab side, so at least there's samples there that we can see. I know Promote's team has also done some susceptibility testing for swabs that work directly with our tests, but obviously we need to validate it.
It would be easier from a regulatory standpoint, all right? So that would be one advantage, and the other part is we don't have to test for all pathogens. If you look at the other pathogen that we detected at a slower frequency, they don't have the impact that EHV1 has. Right now, it's all about EHV1. I disagree a little bit with that. Every single respiratory pathogen is impactful, but when you look at the challenges that the industry is faced when it comes to EHM outbreak, it's all about EHV1 testing right now. That's why you guys have the right test at the right time.
Yeah, no, it's definitely worth considering, especially as we wait for USDA. So, is there any other questions from the group? Feel free to put in the chat or just speak up.
Actually, I have a question for Dr. Bustiller. So, regarding the environmental testing, right? And I do agree that regarding to Laurie's question, it would be easier from the regulatory perspective. However, the intended purpose of the test will be in question. For example, if we detect the sample or the sample concentration of a pathogen in the stall, what would be the clinical assessment of that, and how do we use that for clinical decision? Because if we approach USDA with this new intended use, that would be the first question being asked.
Do you want Eric to answer that one? Just kidding. Just kidding. It's a good point. I mean, it's a cause and effect. You can associate, if you have to assume that the stall was negative to start with. Am I right? You can't just bring one horse after the other in the same stall, never clean the stall, never disinfect the stall. So from a logistical standpoint, if you can detect the pathogen in the environment, you can associate that with the horse that was stable in that environment. I'm not looking at penalizing the horse. I'm more looking at monitoring the environment as indirect means of spread of pathogen. So in other words, a positive stall, if we test 250 stalls and one stall is positive, I would not be concerned. I would say, that fits. One or two stalls, maybe in different locations, different barns, that would fit that subclinical shedding that is, in the single digit. The more concerning part is, can you scroll that back to the Blenheim? The more concerning part is when you start having clusters. So the greater number of stalls out of the same environment, as you can see here, if you look at that barn C, all these red circles represent positive EHV1 stalls. So we need to assume that in each of these stalls, the horse was at some point shedding EHV1. And so that's what I would be concerned if, let's say, I do this barn on a regular basis and I did them 2 weeks ago, and 2 weeks ago I only had stall number 28 come back positive. I would not be too concerned. But now I repeat the same testing 2 weeks later, and now suddenly I have 5 positive stalls. I would not necessarily penalize the horses. I would just look at it and be concerned that there is direct or indirect spread with more horses that in that 2-week period have been shedding EHV1 and contaminating the environment. So it's more looking at the kinetic or the dynamic of shedding and the number of stall over time than at individual stall. And from a regulatory standpoint, I don't think anybody can make you can only make recommendations on what to do with these horses. So you could say, if a stall tests positive, then the horse has to be tested to be sure that the horse isn't actively shedding. If the horse isn't actively shedding, then what I personally would do is clean and disinfect that specific stall and then move on.
Okay, well, if there's no more questions, Nick, thank you so much. Thank you for
My pleasure.
supporting us for the past, it's been maybe 6 years, something, time's flying. But looking forward to really making a difference moving forward now that we have products. So. All right, thanks everyone. Have a great day.